doing well. Thank you.
All right, good.
Appreciate it.
Yeah, welcome to the Black Media Matter Studios.
Thank you for having me.
Yeah, good stuff. So we're talking about something here today. A lot of times we don't. Well, unfortunately, we do talk about death a lot here on this show. We talk about gun violence and things happening out in the city, but something that we don't talk about here a lot is end of life care and hospice care and things like that. And also, usually, if it is talked about, it's never really looked at in a cultural kind of lens. And so, first of all, I'll let you introduce yourself more to our audience here, and then we could talk about your organization and what you guys are trying to do.
Thank you. I appreciate that. So just to give you a little bit of background about myself, I grew up just south of here, graduated from Auburn High School, and, really wanted to pursue something in the social service field and the health field, primarily because of my father's influence. Ended up getting my master's in social work from the University of Oklahoma, got into medical social work, and really wanted to make a difference, especially when it comes to healthcare, since there are a lot of disparities, especially when it comes to like Black health and other underserved groups and populations. And so, the reason that I decided to get into hospice, especially in this part and in Seattle, is primarily because there was a need for it. There are over 9 hospices in King County. None are Black governed or Black owned. And I felt like having representation, the governing body, and for the community to be able to see someone who looks like them representing them in healthcare was important, especially at end of life. And especially because of also the cultural component that you just mentioned. Understanding the culture, understanding the importance of cultural relevance, cultural competency. My work as a medical social worker, I've seen cultural incompetency. I know how that impacts Black families. I've been in Black, families' homes, and understanding how people at the top who are, not of the culture, just not being able to relate. And so,
Yeah,
I saw the need.
I think that we can even be more blunt about it, in that we already know that there's an empathy gap.
Yeah.
In healthcare across America, and we already know that there's all these perceptions about Black people and their tolerance to pain and everything else. And we also know that, man, we got to advocate for our people, especially when they're in the hospital. And so, like, I spent a lot of time the last 2 years just being present in hospitals, because you get treated a bit differently being Black if people know that you got somebody in the hospital advocating for you, that
Absolutely.
you're not there, that you want to talk to the doctor, you want to talk to the medical professional. That gap is real during the living, you know what I'm saying, when you're fighting for your life for everyday healthcare. I can only imagine what that gap looks like when end of life care. When you talk about some of these examples that you see, what are the disparities or the differences that you see when it comes to Black people and how they're treated in hospices?
So there's just generally a lack of trust. I mean, when you think about the experiences that the Black population has had historically with medical systems, there is justified lack of trust. And so already they're going into the situation. I remember I had a family that specifically asked for a Black nurse because they just have had bad experiences in medical systems and healthcare systems. Well, when they asked for that, they were labeled as being racist for asking for that. And so that just kind of just paints the picture of how misunderstood a lot of Black families are when it comes to, and Black individuals are when it comes to healthcare systems. I'll tell you some other statistics in terms of disparities. Specifically, we're talking about the Black elderly population, right? The Black elderly population in America, and this is by the Kaiser Foundation. They came out with this information. Out of any other people group, visited the ER department of hospitals the most, had the most hospital admissions, and also have the most hospital readmissions. And a lot of these folks that are going through this are people that are dealing with terminal illness, that are at end of life, and that should be and would be getting hospice care. And so it's those factors that made me realize, okay, I got to do something. And if I'm going to do it, I got to do it my way. And I partnered up with David Turner, a mentor of mine who had done hospices in Michigan and Tennessee, and just wanted to do something that was Black governed so that people saw representation, so that people could have trust and know, okay, people on the other side look like me and they represent me and are able to empathize, like you said earlier.
Yeah, I mean, more than anything in the life, you need people who one value your humanity and see
Absolutely.
you as a whole person, and two, of course, empathy is real important. You get lots of sympathy, but empathy. Um, so what's the landscape like now? You said that there's 9 hospices that are operating here in King County. Your hope is to become a number 10,
Right.
right? What is that process like to go? And maybe you can explain to everybody where you guys are at in this process.